Welcome, and I am glad you can join us for the information session about our International Master of Public Health program at the Hebrew University of Jerusalem in Israel. So in order to focus us and get a sense of where we are, somewhere here, and if we focus down just a little bit to Mother Earth, to the Middle East, and there is Israel, the center of the universe. And here's the map of Israel, Jerusalem being more or less right in the middle. And as we come closer to Jerusalem and we come to our campus, there is our School of Public Health and our department. So if you come to the campus and you're looking for us, just look for the yellow arrow outside, and then you'll know where to find us. And welcome to our school, the School of Public Health and Community Medicine. My name is Yehuda Newmark, and I'm the director of the school and former director of our international program. And I'm glad to have you with us today. With us as well is Professor Onit Calderon, the director of our program, Dr. Maureen Malawani, the alumni coordinator, Dr. Onit Zinreich, our academic coordinator, Ms. Edna Perez-Yoshpe, our program administrator, and Ms. Irina Zagmut, our secretary. So what is public health? If you're here in this session, you may know already what public health is. You may have experience in public health, or you may be looking for a new direction in life and want to be introduced into the area of public health. Well, the formal definitions, if we take the one from the World Health Organization, public health refers to the organized measures to prevent disease, promote health, and prolong life among the population as a whole. And we indeed do those activities. We strive to reach those aims, to promote healthy lifestyles, to prevent and detect diseases, and to respond to public health threats when they arise. If we think of the current COVID-19 epidemic, pandemic, public health is at the forefront. And we strive to improve access and quality of healthcare. We do this through research, training, and influencing policy. And here at the school, we've been doing this for quite a number of years. Our school is Israel's first school of public health, established in 1961, when we first began issuing our Master of Public Health degree. Our school and our MPH degrees are accredited by the Agency for Public Health Education Accreditation of Europe. And we believe that our programs are in line with a very holistic approach to the research that we do here in the school that stems from the molecular genetic level through the individual and his or her family, up to the macro-social influences and determinants of health. These research activities address a broad range of topics and areas related to public health, and here are just a few of them. And if we look here at the picture, this is a picture of the Korogocho slum neighborhood in Nairobi in Kenya, where we had the opportunity to do some training activities in community-oriented primary care. And we take our research experiences into the field, and we asked questions about the public health challenges facing a community such as the Korogocho area, and how can our research and how can our training help promote health and well-being in such a community. You may be familiar with the Sustainable Development Goals of the United Nations, many targets, many goals, most of them regrettably unmet, But at the base of all of these is the public health and health workforce. And it is the mission of schools of public health such as ours to educate and train public health specialists at the highest level possible so as to improve the physical, mental, and social welfare of populations around the world, in Israel and beyond. Here at this school, we have a number of master level programs: Master of Health Administration, Master of Clinical Epidemiology, Israel's only Master of Veterinary Public Health, of course, our Master of Public Health degrees. We have a PhD program, and we do training workshops. We're going to focus today, of course, on our international program. Our international program was established in 1970. It's a 12-month program of full-time studies in English. And our program has graduated nearly 900 public health professionals from over 100 countries across the globe. We're looking here at last year's cohort, the 2018-2019 IMPH class, so you can get a sense of the broad range of geographic distribution of our students coming from countries, indeed, from all over. You may find your own country listed here. And we move to this year's group who are studying with us now, albeit somewhat challenged under the restrictions of the corona epidemic, but nonetheless studying here full time. And as again, you can see students from Africa, South America, the Caribbean, Asia, and the Middle East. So why come study public health in Israel? There are many public health degrees across the globe. Well, first of all, you may be familiar with the Shanghai Index of Universities. This is an international index that ranks the universities based on the quality of their research and training. And Israel ranks within the top 100 universities of the world. Our university was founded in 1918. We have numerous campuses and faculties. We have approximately 25,000 students, of whom about 10% come from outside of Israel. And Hebrew University is a place where science and knowledge are indeed advanced for the benefit and betterment of mankind. Specifically, our IMPH degree provides a curriculum of study that combines academic excellence with practical skills and tools and knowledge, so that when you return home at the end of our program to address the public health challenges facing your country, facing your community, facing the world, you will have a toolbox with all the necessary tools inside to address those needs and to develop interventions that can alleviate the difficulties posed by those challenges. Our curriculum meets the model of the United States as well as of Europe. It's a blend of the two models. We are oriented towards the quantitative sciences. We have a focus on epidemiology and biostatistics. But in our IMPH program, you'll also be introduced to environmental sciences as they relate to public health, social behavioral sciences, health promotion, health behavior, health policy and management, and economics, and a range of other courses and topics. You can get an impression from the breadth of our curriculum from this list of core courses and elective courses that you'll be taking if you join our program. We won't go through them all, but sort of to peruse through them to get a sense of the breadth and width of our curriculum. Here on the right, you see one of Hebrew University's other slogans. It's difficult, but it's the best. And because it's difficult and because it's challenging and because it's a 12-month program, which essentially is a 2-year program, but taught in and learned in 12 months, so we require that our students have the necessary background when they join the program. So in order to join our program, you need to be a holder of an undergraduate or a graduate degree from a recognized university, and in any of the fields that somehow relate to public health. We encourage applicants not only from medicine and from other medical disciplines, but from allied health disciplines, as well as from social sciences and beyond. So lawyers, economists, data scientists, and others are welcome to apply and are welcomed into our program. We require a minimum GPA of 80%. Here in our university, our Office of International Studies will look at your transcripts and assess what an 80% in your university would look like in our university, sometimes higher, sometimes lower. And therefore, even if you did not achieve exactly an 80% GPA, we encourage you to apply because you're less than 80%, maybe an 80% in our university. I should state that diplomas and advanced diplomas are not recognized as an academic degree. So if you hold a diploma only and not a BA, you will not be allowed into our program. And we do take into account public health experience. It cannot take the place of the GPA requirement, but we certainly look favorably upon applicants who have had at least some experience in the field doing practical work in some realm of public health. One of the other reasons that people are attracted to our program is that we can offer a limited number of scholarships every year to candidates from low-income countries, low-middle-income countries, and transition economy countries. And if you're not sure whether your country fits these definitions, we encourage you to apply, and we'll let you know whether you're eligible for a scholarship. Our scholarships are very generous and comprehensive, and essentially cover all the costs associated with studying and living in Israel during the 12-month program. Tuition, very comfortable accommodations here on campus, a monthly living stipend, health insurance, textbooks. We have a very active social cultural program, and all administration fees that are associated with our program. Also, our program takes place in Jerusalem. It's the center of several religions, and all are welcome here. And as Elie Wiesel, Nobel Prize laureate, said, Jerusalem, no one can enter it and go away unchanged. And I think that if you would ask our graduates, they would say that this is definitely a true statement. So while here in Israel, despite the heavy curriculum of studies, we'll show you a good time. We'll expose you to both the historical and modern Israel, to the wonderful sights, take you to the Dead Sea, take you on several trips. You'll join us in the Jerusalem Marathon and other activities, hanging out on campus, join us in our homes, and all in all have quite an enjoyable year. We have opportunities during the year, especially at our graduation, to display your country's culture and dress, and we certainly encourage the sharing of the cultures, foods, traditions of all of our students with us and us with them. We have an active professional site visit program alongside the in-class course learning. So we will expose you and introduce you to quite a number of activities at non-governmental agencies, governmental agencies, volunteer agencies that Israel offers for their elderly, for people with disability, and so on. We'll share with you our customs and our traditions and invite you to celebrate our holidays and festivals with us as we will with you. But yes, you will spend quite a bit of your time during the year in class. Our studies take place 5 days a week, from morning till afternoon, evening. The weekends are devoted to exercises, homeworks, group projects, as well as trips and all of the other activities, the extracurricular activities. Our graduates go home to assume key positions, senior positions in their countries, in clinical work, in research, in government, and in non-governmental sectors in their countries. Here's just a few photos of some of our graduates doing the work that they do, again, in the field, in the radio station, if it's a program about violence against women, if it's politicians, in a press conference about polio eradication vaccines, and so on. We also encourage lifelong learning, and our graduates are invited to attend conferences and reunions in different places, here in Africa, some of the pictures, or in Jerusalem. And we have a range of other activities with our alumni. We invite our alumni to our stellar graduates to come back and do a PhD. We can award seed grants for research projects that our alumni undertake. We have a mentorship program, and we have many other programs to encourage our graduates to maintain their public health academic level. So here's our last conference was in Accra in Ghana on the topic of investing in the future by strengthening health systems. This is just one of the, as I said, conferences that our graduates participate in. So I invite you to join us. I invite you to consider registering for the program. Here is the link for our online registration system. Visit our website, email us with any questions, with any concerns, and we'll be happy to be in touch with you back with all answers as we can provide them, as honestly as we can provide them, and as quickly as we can provide them. Registration for the 2021 program is still open until the end of June. We extended the registration period because of the corona crisis, and we know that some people were dealing with that and therefore were unable to register in time, so we extended our registration period for another 2 weeks, and we encourage you to apply until then. If not, for the following year. So thank you for joining us, and we look forward to welcoming you to Israel, virtually for now, but hopefully in person in the very near future. And just before we close this session, we have a special treat for you. We've invited one of our stellar graduates of the International MPH Program to join us today and to share some thoughts about the program and how the program maybe helped her in her developing her absolutely phenomenal global career. Our graduate is Ambassador Dr. Josephine Odhiambo from Kenya. Her CV is too long to address here. Former ambassador to the United Nations, former Deputy Secretary General of the Commonwealth, and many other local and global positions, awards, accomplishments. And while there are many graduates who have done fabulously professionally, Josephine stands out amongst them, and we've asked her to join us today. Dr. Odhiambo, please.
Thank you very much, Professor Yuda Newmark. Good morning, friends, colleagues, and potential students of the Hebrew University of Jerusalem School of Public Health and Community Medicine. The one thing I want to assure you in the short time I have to speak with you is that any of the achievements I've been able to put on record are largely a testimony of the first-class quality of the Hebrew University of Jerusalem School of Public Health. So at the outset, I want to first of all tell you that your decision to come and study public health and community medicine is a very good decision, and you're going to be part of a family of graduates, a faculty, and a part of a larger scope of the global community in public health. It's a wonderful decision you've made. I want to let you know that the studies you'll undertake will open your eyes to a set of global public health issues, issues on health systems, issues on health services, issues that focus on child development, on demography, the study of HIV/AIDS, perhaps the study of pandemics, including the current challenge that we all face as a global community with the COVID-19. You'll also be looking at issues of clinical epidemiology, monitoring and evaluation, and several others. All of these will sound like big names, but when you come to the school, you learn how to use them as tools. And I want to tell you that the toolkit you'll walk away with will be useful for the rest of your life. Inside this toolkit, one of the very important skills that this particular school is known for is a toolkit on social epidemiology. You couldn't learn it any better anywhere else. This will help you to lay down measurements about the theory of change in whatever area of public health you want to engage in. You'll also learn about survey methods. And once again, there's no better master than the Brown School of Public Health on the issue of survey methods. You learn how to determine the needs and the factors related to your interventions. And then another tool you learn about is the administration of health systems. I call it the can of engine oil, the one that you mustn't forget to carry as you undertake your work on a day-to-day basis. And the last and most important is the coolant of teamwork, the teamwork that you're exposed to when you go out and do your projects, when you write your dissertation up, and indeed the dynamics all through the course. And it's truly an international team. You'll have students from South America, from North America, from Europe, from the Middle East, from Jerusalem, and even from what we called, when I studied, the occupied territories. You'll have students from Africa, the North, the South. You'll have students from Asia and the Pacific. So the team dynamics are truly international. And I want to ask that you will make and keep a memory of the classwork, the fieldwork, the mentoring, the recreation, the culture, and the people you meet there, because these together will keep you alive throughout the course, but will propel you into the future. And all these become the passion with which you then undertake your work at community level, facility level, nationally, and perhaps internationally. I want to let you know it's not just the studies at the school, it's the short courses that you engage in afterwards, if possible, and I want to ask that you do take advantage of them. When I went back to Kenya after my training, I was happy to engage in a short course on emergency medicine. At that time, based out of our country's largest referral hospital, Kenyatta National Hospital, but with the same team from faculty. We had disasters then, like the collapse of large building complexes in our capital city. But even after we left the school, During the early days when I was trying to find my feet after I got my master's in public health, I joined the Shalom Club. And this club gave us a social opportunity to keep engaging with the Hebrew University and with colleagues who were trained in Israel. And then, more special and more focused, we put in place a small group of alumni, which has grown to be a big alumnus gathering. And the alumni of the Hebrew University and the School of Public Health meet very regularly. They meet globally, online, even now, but they also meet regionally to discuss things like malaria control in East Africa, to discuss setting up schools of public health like we did for the newly independent Eastern European states, and in other settings. And each of these gatherings focuses on a technical issue, but also brings to life the memories of the skills and the experiences from Israel. The gatherings are always warm and will leave you feeling inspired to go back to your workstation and to keep going. Personally, my experiences have taken me beyond Kenya. Even as I graduated, little did I know I'd work for the United Nations. And when that opportunity came, I did work for UNICEF. But beyond that, I've also worked around Kenya in the municipalities of Kenya. I've worked in South Africa. I've worked in West Africa. I've worked with heroes of the liberation struggle in South Africa and West Africa around women's issues and their health. People like President Eileen Sirleaf Johnson on ending violence against women and girls. I've also worked with Senator Hillary Clinton when she was in government. And I met her in Washington. She gave me a grant to which I took back to the University of Nairobi, to the Department of Obstetrics, to end female genital mutilation and to improve the health of the girl child. I've addressed special forums on research, on professional medical education with doctors and dentists, on global platforms, in international settings. I've worked at the United Nations, as you've heard, my country's ambassador to the UN, where I've spent many hours drafting international resolutions. I'm particularly proud that I contributed to the political declaration on HIV and AIDS, as well as I did participate to setting up the Non-Communicable Disease Alliance at the United Nations. So all of these things bear testimony to the great quality of the Masters of Public Health that you're about to undertake. But I want you to know that success comes with a notion of stress. It comes from strength. It comes from human effort. But we're not necessarily called to success. We've been called to be fruitful. We've been called to be vulnerable, to come from an admission that we need to keep growing. And if you can do that and face your own need to become, in every setting, a person who is productive and looks forward to new horizons, then together with me, you'll want to undertake this course so that the fruits of your contribution to your own society would grow. You've made a wise decision. The School of Public Health is going to take you forward and into your future. We'll all be there looking forward to welcome you and to walk with you into your future. Thank you.
Thank you, Josephine, for those most inspiring words. And I think that the participants today's session and those who will be viewing this will take those words with them, whether they choose to come to Israel in the end or not, and throughout their lives. We aspire to those kind of achievements. And we hope that for those who do choose to come to our school and study in our International MPH program, these words will inspire them throughout and will join the international global IMPH alumni network, of which you are a proud member. Thank you. Thank you to all those who are watching, and we welcome you again to reach out, register, visit our website, ask questions, and we will be here to welcome you to Jerusalem if and when that is in reality where you are to be. Thank you very much. Good day, good evening, good night to all.